meeting. Thank you for coming, and tonight we will welcome first up Chad Bishop as our first guest at the podium. Both items tonight are on non-agenda items.
Port 05 South Valencia Drive here in Sioux Falls. As the largest school district in the state with over 1,800 teachers and 24,000 students under your care, what you do here matters. On November 8th and the 22nd, I addressed this body where I asked you to offer, if not require, screening for SARS-CoV-2 antibodies or adaptive T-cell response prior to administration of the vaccine for children on the district property. I now understand this is being done by the city at the community centers co-located at the district facilities. I'll persist in this request to the city council tomorrow night. In addition to informing families about screening, I would ask you to consider offering reimbursement for all teachers and staff who would want to pursue either antibody or adaptive T-cell response assays to ascertain their own immune status and whether they are vaccinated or not. This week, the mayor of New York will require children as young as 5 to be fully vaccinated and to show proof of vaccination to dine out. Medical apartheid in the United States of America. Papers, please, in the United States of America. When questioned on CNN by Sanjay Gupta, Dr. Fauci had to concede natural immunity had to be discussed seriously, having no firm answer when asked to justify vaccination for the COVID-19 recovered after the Israeli data was published. In this exchange, Dr. Fauci falls back, questioning the durability of the response. How long will it last? That's his only answer. That has been a legitimate concern for those who have never taken Immunology 101. So what does it mean when the Argus Leader reports on October 17th of this year that better than 99% of all South Dakotans who have either been vaccinated or recovered from COVID-19 have not tested positive or tested positive a second time? It means that it has been 21 months since the first case of COVID-19 was diagnosed in the state, and less than 1% have been reinfected according to the state epidemiologist. How much less than 1% is my question. This is empirical data answering Dr. Fauci's question over the period of 21 months. At this point, I'll provide a link to my statement to the City Council calling into question their vaccination campaign target and the lack of serology included in their plan and in the state plan. Here I will extend my request to you as community leaders for us to deal with this issue as a district, as a city, and as a state. This is a 1-in-100-year pandemic where we have literally created trillions of dollars of debt to deal with the fallout, and yet we have utterly failed to avail ourselves of the many tools available to us, specifically serology as a discipline and component of epidemiology. As of today, there have been 144,290 cases documented by the Department of Health in the state per the statements to the City Council Per the statements to the City Council that I mentioned before, that represents only a fraction of the total infected and recovered per the CDC's own epidemiological models. The question I ask them is, why aren't we doing the serology, and why don't we know the answer to the question of what number of South Dakotans have recovered? There's now over $974 million for COVID-19 relief in the state treasury. In an attempt to use science to resolve these artificially divisive political issues, rebuild trust with a skeptical public, and bring clarity to policymaking at all levels within the state, including this district, I am asking for you to call upon the state legislators and the governor to allocate funding for the following campaign. Acknowledge all COVID-19 recovered status as superior or equivalent to that of vaccination for all South Dakota residents. Reimburse all South Dakota residents for SARS-CoV-2 antibody tests and adaptive T-cell response tests, including N-type antibody-capable assays for obviating the need for further boosters. Call for the immediate release of the Sanford Survive Antibody Surveillance Study. Where did that go? Why didn't they publish it? They announced it, and the data has not been made public. The Department of Health to solicit and compile anonymized serology data from the blood banks. The Department of Health to solicit and compile anonymized data serology data from the commercial laboratories. The Department of Health to add to the dashboard a calculation of community immunity from the voluntarily vaccinated plus the COVID-19 recovered. The Department of Health to expedite and calculate the CDC equivalent for a state epidemic threshold calculation as well as excess death. Use universal reimbursement for antibody and T-cell assays as a means to re-engage the vaccine hesitant, as well as to calculate community immunity. Healthcare professionals not on the front line found ways to work remotely for 18 months. Why are they not being offered this opportunity now? Subsidize rapid testing protocols for healthcare professionals and as alternative to termination, and provide extended benefits to all healthcare professionals that were unjustly terminated by these vaccine mandates, whether public or private. Thank you for your time.
Thank you, Chad.